Good morning. The title of my presentation is Laws, Flaws, and Actions Stalled, and I'm going to be presenting about a regional review that's looked at how laws and policies affect access to SRH, sexual reproductive health, and HIV services for young people in Asia and the Pacific. So maybe just to say a few words about the context of Asia Pacific. So the region is home to 750 million young people aged 10 to 24. It's actually the largest cohort of young people in the history of the world. And while they have greatly improved access to education and health, sexual and reproductive health is often an overlooked aspect of their well-being. There are about 6 million adolescent pregnancies per year in the region, more than 1 million unsafe abortions, and while we are seeing HIV incidents decreasing in many countries in the region, in 7 countries, we actually are seeing rises as high as up to 10-fold in the last decade. So in this context, in any context, there are multiple factors that can impact and determine a young person's access to information and services. They can be logistical, they can be cultural, they can be institutional, and they can be related to policy and law. Some of these factors are the same as those for adults, such as distance. Others may be more related to their stage in life, and that can be things like financial, where they actually need to ask their parents for money because they don't have independent access to pay for the services. We wanted to know, what about laws and policies? This is the first systematic review that was commissioned by 3 UN agencies in the Asia-Pacific region and 1 youth network. It was undertaken by John Godwin, who has done a number of the other legal scans in the Asia-Pacific region. How do we do it? It's primarily a desk review. We looked at laws, regulations, and policies from 32 countries in the Asia-Pacific region. There were more than 400 documents that were reviewed, including national laws, criminal laws, those related to age, health and HIV. We also looked at policies across a range of issues, including youth policies, the health policies, population policies, and we looked at commitments, things like commitments to the Convention on the Rights of the Child. And the review also drew on the scans that I referred to earlier, including those that had already been conducted on men who have sex with men, on transgender people, and on sex workers. We recognize that what exists on paper is often very different from what exists in reality. So we also did focus group discussions with young people, including young people from key populations, and interviews with service providers in 3 cities in the region. Now, these focus groups were youth-led and developed in partnership with youth, which added an additional element of building also capacity throughout the research process. So what did we find? Our first finding is that in many countries in the region, you're actually old enough to be tried for a crime. So you can stand trial for a criminal offense. And what you see here is the minimum age of criminal responsibility. So 7, 8, 9, 10, by 14 years old, in many countries, young people are expected to take responsibility for their conduct in society and to face those consequences. But are they old enough to make decisions about their own health? In many cases, the answer is no. This slide, which looks very complex, but I'm going to try to walk us through, looks at some of the mismatch that we see in laws, and that includes differences between the age at which a young person can consent to sex, the age at which they can marry, and the age at which they can access sexual and reproductive health services. And in many countries, the age at which people begin sex is also different again. So here we can see, and this is only one set of countries from those that were analyzed, but we can see here that in most of the countries, in all of the ones here, but in most of the countries that we reviewed, you do not have access under the age of 18 to independently consent to medical interventions. Now, if we look at the data on the age at which you can consent to sex, in many countries, there is recognition that young people can consent to sex from an earlier age, as you can see here, as low as 12 and as up to 15. Now, where the age of consent to sex is lower than the age of consent to medical services, young people are legally recognized as having the maturity to consent to sex. but they're unable to consent independently to the services that they need to protect their sexual and reproductive health. The gap between the needs for services, now this is looking at heterosexual sex. Now the gap between needs for services and access is obviously much larger for lesbian, gay, bisexual, and transgender people for whom their sexual activity is criminalized. The final column looks at the age of marriage, the age of consent to marriage. Now, while the minimum age of marriage is considered necessary to protect children from early marriage, in countries where marriage is a prerequisite for access to services, which is 2 of the countries in my region, a high minimum age creates another additional barrier to services for young people who aren't married. We also looked at age restrictions, and this is some of the findings that we had on access to harm reduction services. So while there is existing guidance that there should be no minimum age requirement for people who inject drugs to access harm reduction services, that's not the reality. At least 7 of the countries in our region restrict access to harm reduction. And while we have some efforts to expand the access to testing, and they're included here in the slide as some examples, this is not widespread, and there are still additional barriers to discretion of providers as well as to parental consent. Now, we wanted to also look at police practices as well as criminal law. And I think the issues around criminalization of same-sex relations, of drug use and sex work have been largely covered and well covered throughout the conference program. And they're really critically important, and it's important that we address them. Young people are equally charged for criminalization of these behaviors. They're also exposed to abuses if they're found with condoms and syringes, just as their older counterparts. What's different for a young person is the power dimension. There are power imbalances for young people when their interactions with police, and the focus group discussions that we had, and the quote that's included here from one of the providers that we interviewed, really document that the police extortion, harassment, and violence among young people is really an issue and a problem. Criminal offenses should not be applied against minors selling sex or using drugs. They need protection rather than prosecution. We also have the issue of compulsory detention centers in the region, and young people should not be put into centers with people that are not anywhere close to the same age. They need to be moved into different services, including community-based treatment. We also looked at medical confidentiality, and at least 5 countries in our region allow the parents or the guardians to be notified of a young person's HIV status without the minor's test. So this is huge barriers for testing, and a huge disincentive for a young person. Now, I don't want to only talk about the poor practice. I want to talk a little bit about what some of the good practices as well. So we do see some good practices. While, as I mentioned, many of the laws and policies that I referred to earlier have been designed to protect adolescents, they actually are serving as barriers. And they're not in the best interests of the child, which is a core principle of the Convention on the Rights of the Child. Now, some countries in the region have applied what's called the mature minor principle, which considers the evolving capacities of the child. Now, what that means is that someone under 18 can consent to a medical intervention independently of their parents if they're believed to be sufficiently mature to understand the meaning and the consequences of that intervention. Now, we see this principle applied particularly in the area in the region of HIV testing, and a number of countries have or are proposing expanded independent access to HIV testing, as you can see here. Now, these are good laws and good practices that seek to apply the principle of evolving capacities that I referred to earlier. In addition to these, we also see some other good practice. There are a couple of countries in the region that give the rights of a child under 18 to health care, as you can see here. There are others that also, and those are child protection laws, which I think is really important to highlight. There are also laws that give legal and enforceable right to access SRH and HIV services, including condoms and other commodities. Importantly, anti-HIV discrimination laws, which are found in a number of countries in the region. And these are really important because they protect against discrimination. They can protect when they're applied against discrimination, including discrimination in healthcare settings. And finally, I should highlight that the policies appear to be moving a lot more faster. Legal reform takes a lot of time and a lot of effort and a lot of commitment, political commitment. I think the policies in some settings are moving much faster. So we were able to find at least countries that had at least a framework that could be applied for rights-based sexual and reproductive health and HIV programs. That's not enough. It certainly isn't enough good practice. We need to scale it up. I think the issue of parental consent in the sessions that I've been in, particularly young person sessions, have come up again and again as a really important issue. It's also come up in some of the work that's gone through the pact, and young people are saying this is really an area that we have to prioritize and that we have to address. We have to recognize that young people have an evolving capacity to make independent decisions about their own health care. We also need to look at the legal reform recommendations that were made by the Global Commission on HIV and the law. These need to be applied. They apply also for young people. Health workers also need guidance. They need operational guidance to understand what it means to apply the mature minor principle, what it means to understand some of these issues around inclusion and equity and why a young person needs access to services, and they need training. And we need to look at law enforcement. We need to look at these abuses. They cannot happen. Harassment, extortion, and violence, they should not be practices of our law who is meant to be protecting each of us. They should be punished, and we really need to expand some of the legal aid services that are available for young people. Again, policies need to guide actions so that these laws are implemented in practice. And finally, and certainly not least, we need to continue to engage young people. We need to engage them in our advocacy efforts. We need to engage them in expanding some of the decision-making and practice in this area. Finally, I have a limited number of copies, and they're quite heavy, of the report on which this presentation is drawn, and we'll be happy to also send them electronically if you're interested. And just to say that yesterday Justice Kirby mentioned that we have a lot of reports and we don't have a lot of action. And so in the region we're also now looking at how to advance some of the recommendations, and two areas of work that we're now trying to advance in the next couple of years are looking at how we can advance, how we can develop a sort of advocacy toolkit for young people to look at some of the SRH HIV issues and policy reform. And we're also going to be supporting in the countries that are reporting to the Convention on the Rights of the Child, and through the Universal Periodic Review process, some shadow reporting so that they also have an opportunity to voice some of the issues that they're facing at the country level. Thank you very much.